بسم الله الرحمن الرحيم. سوف نبدأ بمحاضرات الأونكولوجي اللي تشمل اللوكيميا، ليمفوما هوجكن and non-Hodgkin lymphoma and solid tumor. Predisposing factors for malignancy mostly are unknown. Increased risk because of their constitutional makeup of children or exposure to cancer-causing agent. So, most common cause is unknown for malignancy. Signs of childhood cancer: unexplained weight loss, headache, often with early morning vomiting. Second, increased swelling or persistent pain in the bone, joint, back, or leg. Lump or mass, especially in the abdomen, neck, chest, pelvis. Development of excessive bruising, bleeding, or rash. Constant infection. A whitish color behind the pupil. Nausea which persists or vomiting without nausea. Constant tiredness or noticeable paleness. Eye or vision changes which occur suddenly and persist. Recurrent or persistent fever of unknown origin. Leukemia. The leukemia may be defined as a group of malignant disease in which genetic abnormalities in the hematopoietic cell give rise to unregulated clonal proliferation of cells. نمو غير طبيعي لخلايا الدم. Acute lymphoblastic leukemia account for approximately 77% of cases of childhood leukemia. This is the most common type of leukemia in children اللي هي ALL, acute lymphoblastic leukemia. Lymphoblastic leukemia are proliferation of cells of lymphoid line. Myeloblastic leukemia are proliferation of cells of granulocyte, monocyte, erythrocyte, or platelet line. What is acute and chronic leukemia? Acute leukemia is accumulation of over than 30% of the malignant white cell in the bone marrow and the blood. يعني إذا نشأ أكثر من 30% blast cell. This is acute leukemia. Chronic myelogenous leukemia is myeloproliferative disease characterized by the predominance of relatively mature myeloid cells. Mature myeloid cells. Acute lymphoblastic leukemia, ALL, was the first disseminated cancer shown to be curable. It actually is a heterogeneous group of malignancy with a number of distinctive genetic abnormalities that result in varying clinical behaviors and response to therapy. Epidemiology. ALL has a striking peak incidence at 2 to 3 years of age. More in boy than in girl. More in white population. More in advanced socioeconomic status. More common in children with certain chromosomal abnormalities such as Down syndrome, Bloom syndrome, ataxia telangiectasia, and Fanconi anemia. Etiology of leukemia. Unknown etiology. Idiopathic. Or several genetic and environmental factors, or can be due to exposure to medical diagnostic radiation both in utero and in childhood. It is associated with an increased incidence of ALL. In certain developing countries, there is an association between B-cell acute lymphoblastic leukemia and Epstein-Barr virus. Cellular classification. The classification of acute lymphoblastic leukemia depends on characterizing the malignant cells in the bone marrow to determine the. يعني احنا بنشوف بالكمبيوتر blood picture blast cell. We suspect leukemia to diagnose it accurately by bone marrow. In the bone marrow, there are many studies done to diagnose the type of leukemia. from the morphology of the cells. Phenotype is studied as measured by the cell membrane marker and cytogenetic and molecular genetic features of these cells. From the morphology, it is usually adequate alone to establish diagnosis according to the French American British classification, FAB classification system. Acute lymphoblastic leukemia is classified according to this classification into 3 groups based on the morphology, L1, L2, L3. This is the morphological study for these cells. L1 are small cells with scant cytoplasm and absent or inconspicuous nuclei. L2 lymphoblasts are larger with more prominent nuclei. L3 are large with deep basophilic and vacuolated cytoplasm and prominent nucleoli. Acute non-lymphoblastic leukemia is classified into groups based on the morphology as M0, M1, M2, 3, 4, 5, 6 to M7. This is for the acute non-lymphoblastic leukemia. But acute lymphoblastic leukemia L1, L2, L3. This is the morphological study. Phenotypically, the surface markers show that approximately 85% of cases of ILL are classified as B lymphoblastic leukemia. 15% are T lymphoblastic leukemia. 1% are derived from mature B cell. The rare leukemia of mature B cell is termed Burkitt leukemia, and it is one of the most rapidly growing cancer in a human. The polymerase chain reaction PCR and fluorescence in situ hybridization اللي هي تسمى FISH technique offer the ability to pinpoint molecular genetic abnormalities and can be used to detect small number of malignant cells at diagnosis as well as during follow-up. Minimal residual disease. The development of DNA microarray makes it possible to analyze the expression of thousands of genes in the leukemic cells. Clinical manifestation. The initial presentation of ILL is non-specific, for example, anorexia, fatigue, malaise, irritability, and intermittent low-grade fever. Bone or joint pain, particularly in the lower extremities, about 20%. Sign and symptom of bone marrow failure, for example, pallor, fatigue, exercise intolerance, bruising, oral mucosal bleeding, or epistaxis, as well as fever caused by the infection or the disease itself. Lymphadenopathy, hepatosplenomegaly, testicular enlargement, CNS involvement, for example, cranial neuropathy, headache, seizures. Physical examination. Pallor, listlessness, purpuric and petechial skin or mucous membrane hemorrhage, lymphadenopathy, splenomegaly, less often hepatomegaly, 25% of children present with severe bone or joint pain. Rarely patients show sign of increased intracranial pressure. Respiratory distress usually is related to anemia or large anterior mediastinal mass. CNS symptoms are seen at presentation in 5% of patients. Testicular involvement is rarely evident at diagnosis, but prior study indicates occult involvement in 25% of boys. Diagnosis of leukemia. From peripheral blood, find that the findings that indicate bone marrow failure is anemia and thrombocytopenia. Bone marrow should be examined promptly to establish the diagnosis, including bone marrow aspiration, biopsy, flow cytometry, cytogenetic, and molecular studies مثل ما ذكرناها. Also CSF examination to see if there is malignant cell, blast cell. Life-threatening complication of leukemia, overwhelming infection, bleeding, severe airway obstruction, and hyperleukocytosis, defined as white blood cell leukemia blast count more than 100 multiplied by 10 can result in damage to the vital organ in children who have acute and lymphoblastic leukemia. Prognostic indicators. This is important. The most important prognostic indicator is the response to treatment. It is the single most important prognostic factor. Second factor is demographic characteristic. Standard risk patient يعني اللي عندهم better prognosis are aged between 1 to 9 years with a presenting white cell less than 50,000. Approximately 75% of patients with B-line leukemia are standard risk. يعني T poor prognostic. Boys have worse prognosis. نعيد. Better prognosis between 1 to 9 years. Bad prognosis less than 1 year and more than 9 years. Better prognosis less than 50,000 white cell. إذا more than 50 poor prognosis. A T cell poor prognosis, the B cell is better. The boy is poor prognosis and the girl is better. Differential diagnosis. When only pancytopenia is present, aplastic anemia is the differential diagnosis. But in failure of single cell line, the differential diagnosis is transient erythrocytopenia of childhood, ITP, congenital or acquired neutropenia, is rarely the presenting feature of ILR. Infectious mononucleosis, juvenile idiopathic arthritis, acute myelocytic leukemia, and other malignant disease that invade the bone marrow, including neuroblastoma, rhabdomyosarcoma, sarcoma, and retinoblastoma. Standard treatment involves initial therapy termed remission induction, يعني induction of remission. It is designed to eradicate the leukemic cells from the bone marrow. With this approach, 98% of patients are in remission, as defined by less than 5% blast cell in the marrow and a return of neutrophil platelet count to near normal level. الخطوة الأولى في علاج مرضى اللوكيميا هو هذا الستيج اللي هو induction of remission. تقريبا 4 إلى 6 أسابيع. وكل أسبوع ينعاد الكومبليت بلاد بيكتشر إلى أن تنزل البلاست سيل تختفي. نعمل بون مارو. البون مارو إذا بينه أقل من 5% بلاست سيل we are reaching the remission stage. Second stage is consolidation. This focuses on intensive CNS therapy in combination with continued intensive systemic therapy in an effort to prevent later on CNS relapse. Third stage is intensification. Many regimes provide 14 to 28 weeks of therapy, multi-agent chemotherapy including diatarabine, methotrexate, asparaginase, and vincristine. The maintenance phase of therapy, which lasts for 2 to 3 years depending on the protocol used. What is a protocol? Patient with malignant disease has a protocol اللي هو الخريطة اللي نمشي اللي نتابعها بالعلاج. يكتب عليها اسم المريض، وزن المريض، surface area، الأدوية مرسومة ومحسوبة بالأيام والأسابيع والأشهر، والدوز إيش قد ننطينه للمريض. نتابعها خطوة بخطوة يوم بيوم إلى أن نكمل العلاج. Small number of patients with particularly poor prognostic features may undergo bone marrow transplantation during the first remission. Treatment of relapse. Relapses occur in bone marrow in 15 to 20% of patients with ALL and carries the most serious implication, especially if it is occurred during or shortly after completion of therapy. Intensive chemotherapy with agents not previously used in the patient followed by allogeneic stem cell transplantation can result in long-term survival for some patients. يعني المرضى اللي عندهم relapse نستعمل معهم intensive chemotherapy and bone marrow transplantation. The incidence of CNS relapse has decreased to less than 5% since the introduction of preventive CNS therapy. The treatment includes intrathecal medication and cranial or craniospinal irradiation. Systemic chemotherapy also may be used because these patients are at risk of a subsequent bone marrow relapse. Most patients with CNS relapse do well, especially those in whom the CNS relapse occurs longer than 18 months after initiation of chemotherapy. يعني قد ما يكون relapse early on يكون bad prognosis, later on يكون better. Testicular relapse occur in less than 2% of boys with ALL, usually after completion of therapy. Such relapses occur as painless swelling of one or both testes. The diagnosis confirmed by biopsy of the affected testes. Treatment include systemic chemotherapy and possibly local irradiation. A high proportion of boys with testicular relapse can be successfully retreated, and the survival rate of these patients is good. Supportive care for leukemic patients. For any malignant patients, there is many supportive care. First of all, transfusion therapy if it is often is necessary. Packed RBC or platelet concentrate. Treatment of the infection. If the patient becomes febrile, appropriate culture of the blood urine site of local infection should be obtained promptly, and intravenous administration of broad-spectrum antibiotics should be started immediately. If there are respiratory symptoms, a chest radiograph should also be obtained to look for the infiltrate. Metabolic support is necessary in patients who have large tumor burden as presented by a high white blood cell or significant organ infiltration. These patients are at risk of tumor lysis syndrome اللي هو hyperuricemia, hyperkalemia, hyperphosphatemia, and hypocalcemia with renal failure. Prevention of tumor lysis syndrome. احنا ما دام نتوقع انه راح يحدث التيومر لايسيس سيندروم او احتمال انه يحدث، فعندنا خطوات من بدايه العلاج نتبعها to prevent the tumor lysis syndrome. اولا vigorous hydration، 2 allopurinol، 3 in case of severe uric acid elevation we can use urate oxidase with alkalinization of the urine, and patients must receive prophylaxis for pneumocystis carinii pneumonia during chemotherapy and for several months after completing treatment. Prognosis of leukemia. Improvement in therapy have resulted in significant increase in survival rate, with current data showing overall 5 years. Survival approximately 90%. However, survival are more likely to experience significant chronic medical conditions, including musculoskeletal, cardiac, and neurological conditions.